next presentation will be online pharmacology course by Rhonda Witherite, Amy Hagen, and Helen Rogers-Kuhn from Central Pennsylvania Institute of Science and Technology. And I apologize in advance if I pronounce anything wrong.
Okay, I think we're ready. Good morning, everyone. My name is Amy Hagen, and I'll be presenting with my two co-instructors, Helen and Rhonda. So we are going to talk today about our online pharmacology course that we have implemented at our school at CPI for practical nursing students. And so to give you a little bit of background about that program, whenever I was getting my master's degree from Walden University several years ago, I had to do, as most of you may know or will know in the future, a project for my final semester. And so in talking to my coworkers at the time, trying to think of what we could use here at our school that would benefit us as well as finishing up my master's degree. So we really wanted to incorporate some more learner-centered courses and get our students involved versus them just sitting in the classroom and getting the lecture component from us. So collaboratively with me and their input as well, we came up with the online pharmacology course. So to start, I'm just going to kind of show you guys what is included there. We use Blackboard as our program for our online classes, and we actually have that with a consortium with some other nursing programs locally. So the cost is a little bit less because we share it, and now it's even more beneficial because we've incorporated the online course from Pharm. We've implemented that into our other classes as well. So we use it now much more than when we started this, which was probably, like 4 or 5 years ago is when we actually started it. Yes, and it is also online for those students, which a lot of our students do go on for their RN. So it benefits them in that process. So this is very much the setup that we have for most of our online courses. And for the Pharm, you can see this is the home page. So on this page is basically for them to organize, like if they want to put stuff on a calendar. We have an announcement page that we can send them announcements, which we do, like reminding them of when things are due, different things that they may need to know about. So that announcement page is for the instructor to post information. And so these are some of the things. We have Helen's course pulled up right now to show you. So after the home page, the next tab there is the course outline or syllabus, whatever you guys use for your churning of that. So the syllabus then, everything is linked to SkyDrive so that the students don't have to have a certain program. They just click on the link and then it opens it for them, and they can either download it or they can print it, whatever they prefer. So right now Helen's opening that. So you can see we have everything outlined here in the course outline as far as the units, what is covered, and then we also have the instructional activities that the students are going to do for each of the units included in the syllabus. And so we have pharmacology in 2 of our levels, but we first started using it in level 3, which is the med administration. When they learn that, they do 1 unit is basically math, administration, IV, administration of medications and care. And so you can see the objectives, the activities, and so it's very clear cut. It's all together for them to see and to organize their class.
With this unit, it's the preparation like IM sub-Q, so we have linked to some YouTube websites.
They're right there.
That if they just click right on it'll connect them right to YouTube so
And
they can see.
we require that they look at those before we have the lab. So it's not all online, like it's a hybrid class. So part of it is online and then the other part is in the classroom setting as it was previously. So they still have the in-class lab component, but having them look at these videos prior to, it really helps once they get to the lab that they've already reviewed, you know, how do you do an IM, a sub-Q, PO, and the steps. So it's not the first time that they're, you know, getting the content at the lab. So that was a neat thing that we incorporated as well. And then we have PowerPoints, which we can show you.
Before we move on with this last one, with the changes in the IV therapy and the central line, we linked right to the state, the scope of practice. So they, you know, should pull it right up. Oops. Go back too far.
Okay, the next tab is the lessons. So the lessons are the PowerPoints that would be given in class that now the students are going to do and view on their own. And then each of those PowerPoints, as I mentioned earlier, can either be printed by the student or they can also download that onto their computer. And then we have, if you want to go back.
Back.
Objectives.
Oh. Sorry.
There, and the objectives are listed, so they have a clear idea of what the objectives are for each PowerPoint.
And I tell the students those are the exact notes that I would be standing in front of them teaching from.
And you have to really stress that because otherwise, you know, if it's their first online class, they are so used to getting everything in the classroom setting that it can be, you know, causing a lot of anxiety for them if they don't know that otherwise. So, and we encourage them, you know, that they can work together on this. It's not like they have to sit by themselves at their house and work on all of the lessons. They can, you know, work collaboratively, and so that is a good opportunity for them to work together.
On that point too, we have a couple other classes that are online. We have a nutrition class, and I teach in the part-time program. The part-time program has a little bit of a different type of student, and we required that the students for the online, they had to have a 90 or greater in the bioscience before they could do the nutrition at home online. I had several students, at least 5, that were so nervous about doing this. They had 95 or above grades, but they came to school because they were afraid to do this on their own.